Good morning, everyone. Till now, we have learned about the structure of the heart, blood circulation, heartbeat, cardiac cycle, pulse, and blood pressure. Today, we are going to study something very important. What happens when the heart becomes unhealthy? Can the heart become sick? Can it stop working? What is a heart attack? Is heart attack the same as cardiac arrest? Let's understand everything step by step. Why does the heart need its own blood supply? First, I want to ask you a question. The heart pumps blood to the whole body. But who supplies blood to the heart itself? Think carefully. Can the heart survive without oxygen? No. The heart also needs oxygen and nutrients. These are supplied by special arteries called coronary arteries. These arteries supply oxygen-rich blood to the heart muscles. Now imagine a water pipe. If dirt accumulates inside the pipe, what happens? The opening becomes narrow. Less water flows. The same thing can happen inside coronary arteries. Fat, cholesterol and other substances can accumulate inside the artery wall. This forms a plaque. As plaque increases, blood flow decreases. This condition is called coronary artery disease, CAD. What habits can damage our heart? Smoking, obesity, lack of exercise, high cholesterol, diabetes, high blood pressure, stress, unhealthy diet, family history. These are called risk factors. This is one of the most commonly misunderstood topics. A heart attack happens when one of the coronary arteries becomes blocked. Because of the blockage, oxygen cannot reach a part of the heart muscle. Without oxygen, heart muscle cells begin to die. This is called a heart attack or myocardial infarction. What symptoms have you heard about? Chest pain or pressure. Pain spreading to left arm, shoulder, jaw or back. Difficulty breathing. Sweating. Nausea. Weakness. Dizziness. Some people, especially women, older adults and people with diabetes, may have unusual symptoms. Never ignore severe or persistent chest pain. Seek emergency medical help immediately. If someone has severe chest pain, that may be a heart attack. Call emergency medical services immediately. Help the person sit comfortably and stay calm. Loosen tight clothing. Do not let the person walk around unnecessarily. If the person becomes unresponsive and is not breathing normally, trained rescuers should begin CPR while someone calls for emergency help. Remember, quick medical treatment saves lives. Many people think heart attack and cardiac arrest are the same. No, they are different. Heart attack. Problem in blood supply. Heart muscle is damaged. Cardiac arrest. Heart suddenly stops pumping effectively due to an electrical problem. The person becomes unconscious and stops breathing normally. Immediate CPR and defibrillation can be life-saving. Doctors need to know whether the heart is beating normally. For this, they use a machine called an electrocardiograph. The graph produced is called an ECG dot. An ECG records the electrical activity of the heart. Doctors use it to detect many heart rhythm problems and to help evaluate suspected heart attacks. Suppose a water pipe is blocked. How will you find the blockage? Similarly, doctors need to know where a coronary artery is narrowed or blocked. For this, they perform coronary angiography. A special dye is injected into the coronary arteries. Using X-rays, doctors can see blood flow and identify blockages. What if a blockage is found? One treatment is angioplasty. A thin tube with a tiny balloon is passed into the blocked artery. The balloon is inflated to widen the artery. Often, a small metal mesh tube called a stent is placed to help keep the artery open. Sometimes the blockage is too severe for angioplasty. Then doctors may perform coronary artery bypass surgery. In this surgery, a healthy blood vessel from another part of the body is used to create a new route around the blocked artery. Blood reaches the heart muscle through this new pathway. Does heart failure mean the heart has completely stopped? No. Heart failure means the heart cannot pump blood as effectively as the body needs. People may experience shortness of breath, swelling of legs, fatigue, reduced ability to exercise. What should we do every day to protect our heart? Healthy food, exercise, proper sleep, drink water, control stress, avoid smoking, regular health checkup, maintain healthy weight. The human heart beats nearly 100,000 times every day. It pumps thousands of liters of blood daily. Blood vessels in the human body stretch for about 100,000 kilometers. The heart starts beating before birth and continues throughout life. Today you have learned much more than just biology. You have learned how one of the most important organs in the human body works, what can go wrong, and how doctors help patients. Always remember, a healthy heart means a healthy life. Take care of your heart, because it works for you every second without asking for anything in return. Thank you everyone. See you in the next lecture.